Hello, everybody, and welcome to our town hall at the Georgetown Hospital Foundation. We thank you for joining us today. My name is Sandra Taylor. I'm the Executive Director of the Georgetown Hospital Foundation. And as we've all experienced over the last few months, the COVID-19 pandemic has challenged every aspect of our lives. It has not only changed how we work, how we shop, and how we interact with our family and friends, but it has also impacted the health of many and how we access healthcare services. COVID-19, though, has also brought our community closer together. I have experienced firsthand the tremendous support this community has shown our hospital and the hospital staff over the last few months. I extend our sincere, heartfelt thanks for the generosity of individuals, community service groups, and businesses who have continued to support our hospital. At the foundation, that support has come in the form of financial contributions, donations of everything from gloves, masks, face shields, and other forms of PPE, to baby monitors, to ear savers and headbands that take the stress off of staff wearing a mask all day. We have also had many kind donations for staff, ranging from free coffee, to food, to flowers, to personal care items. We have also received outpouring of other types of support from people from all walks of life and visible throughout our community. There have been parades and drive-bys here at the hospital. There have been painted rocks. We've got tons of them here at the hospital, but they're also throughout the community. We've seen signs in windows and on front lawns, and we've had countless social media likes and shares showing support for our healthcare workers. Our goal for our town hall today is to give you an update on what's been happening at the hospital and how your support is making a difference. We have two guest speakers today, and normally they would be sitting beside me, but due to social distancing measures, we will be sharing this chair and coming in and out as we take our turns. But they are two well-known members of the Georgetown Hospital leadership team. Cindy McDonald is our Chief Operating Officer, and Dr. Justin Bussa is the Associate Chief of Staff and an Emergency Department Physician. The format for today will be very straightforward. Each of our guest speakers will give an update. Cindy will be addressing the hospital's response to COVID-19 and the support that the hospital has provided to long-term care homes. And Dr. Bussa will be providing us with some insight into the work currently underway to restart the programs and services at the hospital that were shut down when the pandemic hit. We will follow up at the end with a question and answer period. We do have some questions that were submitted to us in advance, so we'll start with those. We are also accepting questions online. So if you are on the Zoom call video portion, you can submit a question. And at this point, I think we'll jump right in. And to get us started, I'm going to turn it over to Cindy McDonald, Chief Operating Officer at Georgetown Hospital. Cindy.
Thank you, Sandra, very much. And thank you to all of you for joining us today. And please excuse our awkwardness as we change seats here, but it is really important to maintain that social distancing requirement. So it's really hard for me to believe that it's 4 months ago today, on March 15th, following direction from our Ministry of Health and our Chief Medical Officer of Health, hospitals across the province began to significantly decrease surgical and procedural work out of concern that our health system was going to be overwhelmed by COVID-19. We immediately took decisive action to keep our patients and staff safe, and these ministry directives that we received at that time asked us to do a number of things, and I'm going to highlight some of the things that we were required to do. We were asked to reduce clinical work and some procedural work, and that meant postponing elective surgeries and other non-urgent procedures. And the purpose of that was to create capacity within the hospital, bed capacity, resource capacity, and human resource capacity. And I really need to acknowledge the fact that when we talk about ramping down non-urgent procedures and non-urgent surgeries, I've been both a healthcare worker and a patient. And I know that my view of what is non-urgent as a healthcare worker may be very different from my view of what's non-urgent as a patient. So this has been quite impactful, and I really need to acknowledge that. We were also asked to identify extra spaces in the hospital where care could be provided across all three of our hospitals, Oakville, Milton, and Georgetown. That gave us an opportunity to leverage our 3 hospitals working as one system and giving us the opportunity to be creative and thinking outside the box. And one of the examples that I can give you of how we did that was we looked at our 2 obstetrical units in Milton and Georgetown and realized that both units had capacity that we couldn't use for COVID, obviously, because it was an obstetrical unit. So for a period of a month, we consolidated our obstetrics unit in Milton, freeing up one of our units in Georgetown for COVID patients. That's an example of how we were able to leverage our 3 sites. Those directives also asked us to reduce the number of people in our building. And that meant, unfortunately, temporarily saying goodbye to our volunteers and our students, and also actively screening everyone entering our buildings and restricting visitors. For me, that was one of the most difficult decisions that we had to make. It's extremely difficult to decide that you have to restrict people from seeing their sick family members or loved ones. But it was done to protect patients and healthcare workers, but we really need to acknowledge how challenging that's been for everyone. Our ramp down activities ensured that we were limiting and screening the number of people into our buildings to protect our patients and our staff. At the same time, we also established testing and assessment centers in each of our 3 hospitals. And then to assist with turnaround time for test results, we purchased the equipment needed to do the testing in-house. In the early days, all of our testing, after we would swab people, the swabs would go out to a provincial laboratory. And that provincial lab was doing more and more tests every day. So being able to do many of the tests, not all of them, but many of them in-house, allowed us to decrease that turnaround time. To date, we have seen more than 17,000 individuals in our testing and assessment centers and have been able to contribute to the provincial testing strategy. All 3 centers are operating at full capacity and no one is denied an appointment for a COVID test. These were all necessary precautions for us to take in the face of a very serious public health risk. Fortunately, we had some things working in our favor. Our organization was well positioned to respond to this global healthcare crisis, thanks in part to infrastructure investments that we've operationalized during recent years, including in Georgetown, the expansion of our emergency department and the DI renovation that were completed here about 5 or 6 years ago. Although we've had to make changes to the way our hospitals operate, we continue to provide essential services such as emergency services, and we've also continued to do all cancer surgeries, all emergency surgeries, and urgent surgeries. Our COVID-19 pandemic response plan was created with a view to ensure that our 3 hospitals, acting as one hospital system, mounted a coordinated response to what we believed and anticipated to be a surge of COVID-19 patients, particularly the critically ill patient that was going to require an ICU bed or ventilator. The plan that we developed described how we would expand COVID-19 bed capacity to respond to the situation and how we could leverage our existing workforce to make sure that we had the right staff looking after the right patients at the right time. But the surge, particularly in our region, didn't create the volumes forecasted by the province. We certainly saw COVID patients at all 3 of our sites. We had critically ill COVID patients who were in our ICU beds on ventilators, but not the surge in terms of the actual volumes that was predicted. Instead, the pandemic put a spotlight on the vulnerable populations in our communities. I'm sure you'll remember throughout the past 4 months hearing federal and provincial politicians say on an almost daily basis that the most vulnerable to this disease were residing in long-term care homes, retirement homes, and other what we call congregate settings. These are settings where patients or people live in the same facility. They may have their own suites, they may have their own rooms, but they congregate for social activities, dining frequently, and that's where people and staff were being challenged. As this became increasingly apparent, we started to develop what we called, instead of our pandemic response plan, we called it our pivot plan, looking at how we could pivot our attention away from maintaining all these resources for the critically ill, the high numbers of critically ill patients that we weren't seeing, and redirecting some of those resources to this vulnerable population in a sector that we typically are not involved with. The need for this plan was first illustrated and picked up on actually in Georgetown. at the hospital where we began admitting COVID positive patients or residents from a local retirement home in early April. Halton Public Health had declared the retirement residents in outbreak, and this was occurring at the same time that other long-term care homes in the province were making headlines with double-digit death rates and really high infection rates. So working closely with Public Health and the LHIN, and after being invited in by the retirement home, we were part of a small team that went into the home and conducted an infection prevention and control assessment of the home and individual assessments on the 63 COVID positive residents. Our view when we went in was to see if there was an opportunity for bringing some of those residents to the hospital for those particular residents who may have benefited from a higher level of care. This was a very successful engagement, and in partnership with the LHIN, because the residents of the home really preferred to stay where they were, we placed a team of nursing and allied health staff overseen by a manager in the home for several weeks. This has been an exceptional experience for us, for our staff, and I hope for the retirement home as well. It was a partnership that I haven't seen before that meant an incredible amount to all of us involved. Following that experience, we continued to respond to additional requests for assistance. There's many different ways our staff and physicians have provided supports to these sectors, and I'm going to share a few of them. We partnered with our EMS team to conduct COVID-19 mobile testing in 8 long-term care homes. This means we put nurses in ambulances with paramedics who went to different long-term care homes and actually swabbed patients. Over 800 tests were performed in this mobile testing unit. We created a rapid support team of staff and physicians that we could deploy with very little notice. And we deployed those rapid response teams into 5 facilities that required on-site assessments to determine what kind of ongoing support they would need. We created comprehensive support plans for these facilities that has included physician assessments, infection prevention and control, education and coaching of the staff in these homes, nursing staff supporting the full spectrum of care needs of residents throughout the facility, and physiotherapists and physiotherapy assistants for the purpose of reactivation of existing residents and the support of residents who are repatriated back to the homes from the hospital. We provided on-site management of our teams while they were redeployed to these facilities, and that included a manager and clerical support to help on-site. We admitted some residents from these facilities to provide appropriate care for their medical needs. And to date, the facilities that we have supported have been located in the regions of Halton and Peel. And most recently, we provided support to a facility well beyond these regions in an area that had been challenged with high COVID-19 volumes. I have to say a shout out to the teams that went in. From the physicians to the staff who've gone into all of these homes, every single one of these people volunteered to do it. They recognized the need and put their hand up and said, I want to go, I want to be part of this team. And I'm really proud to share that information with you. So before I turn this over to Dr. Bussey, I did want to speak very briefly about visiting patients at our hospital. We know that visiting restrictions implemented during the COVID-19 pandemic have had an impact on our patients and their families. They've also had an impact on us. While some limited visits have been permitted on compassionate grounds, and our virtual visiting program has been hugely successful, there's absolutely no comparison to an in-person visit from or with a loved one. As we begin to resume clinical services, we are also gradually welcoming visitors back into our hospitals. This will not be a complete return to normal for visitors, and for the safety of everyone, it will be a very gradual, phased approach. Last week, we started allowing 1 essential visitor to accompany a patient in the emergency department. This week, we've welcomed designated essential visitors for our long-term or long-stay patients. The plan is flexible, so we can return to a previous phase should circumstances require. And exceptions for visitors and care partners continue to be considered and approved on a case-by-case basis. I would encourage you to visit the COVID-19 section on the Halton Healthcare website for additional information, as this information is planning to be changed on a fairly regular basis. And that change hopefully will see us loosening it week by week, but may in fact have to go back to a more restrictive process if needed. There's no doubt we've seen a tremendous change in how we go about our daily tasks as we continue to fulfill our vision of providing exemplary patient care during these unprecedented times. I can't tell you how proud we are of the physicians, the staff, and the leaders who have been supporting our COVID-19 response plan to protect our community. I would also like to echo Sandra's comments about how thankful we are for all the support the team at the hospital has received over the past few months. Even when times were uncertain, you continued to show that you cared, that you're there for us, and that we're all truly in this together. You made a big difference to us. We're grateful, and we felt the love. Your support helped us get through the past 4 months, and now we're in a position where we're able to begin the restart of services in a very thoughtful and deliberate manner. To update us on our restart plan, I'm now going to turn this town hall over to Dr. Justin Bussa, our Associate Chief of Staff here at Georgetown Hospital. So I'll get out of the way and let Justin join us.
Thank you, Cindy, and thanks to everyone for joining us today. I'm delighted to be talking about our restart plan today because returning to our pre-pandemic operations is really on the top of everyone's mind. Our COVID-19 pandemic restart plan was developed based on a set of guiding principles, assumptions, and key strategic clinical directives to protect our patients, visitors, staff, and physicians. Our teams are working hard as they consider the complex work associated with returning to pre-pandemic levels of clinical activity. And I must say it was a tremendous amount of work and a complex operation shutting the hospital services down as they typically were run in March when we were preparing for COVID. However, what surprised many of us is it's been even more complex, slowly ramping services back up in a careful and measured way for a number of reasons. For instance, many of the medications used to treat critically ill COVID patients are the same medications used in the operating room during elective procedures. And some of these remain in extremely tight supply worldwide. Similarly, personal protective equipment remains difficult to procure in many instances, and increasing hospital use of this equipment with elective procedures and elective clinic visits must be carefully monitored to ensure we have adequate supply to function during any subsequent COVID surge. We had to demonstrate to the government that we met their requirements to restart. And these included that our hospital was having a stable rate of COVID-19 cases and that we were not an outbreak, and we have met that. We had to demonstrate that our communities were having a manageable level or sustained decline in COVID-19 cases, and I'm happy that that is also the case. And we had to demonstrate that our hospitals have an adequate capacity of inpatient ICU beds and staff, and that we had to ensure that we have stable supply of PPE and critical medications. And currently we are also meeting that. So happily, we received approval for phase 1 startup from the ministry in mid-June and have begun the implementation process associated with the carefully thought out gradual increase in clinical services. Many people in our community have been waiting for hospitals to reschedule elective surgeries and procedures that were delayed due to the pandemic. And while we never stopped providing emergency services during this entire time, we are now pleased to be in a position to safely begin providing non-urgent services again that people have been patiently waiting for. So what does phase 1 of the restart include? This is previously deferred diagnostic imaging tests, MRI, CT, ultrasound, X-ray, that essentially in an elective case has not happened in 4 months. So you can imagine the backlog that they're working through. There's day surgery cases will be proceeding that do not require an inpatient stay. There will be limited in-person mental health counseling and some resumption of endoscopy procedures. So this is a positive step forward, but we need to approach this with caution to ensure the ongoing safety of our patients, staff, and physicians. And it's important that we are conservative in our approach to restarting because we need to be ready to respond to any subsequent surge in COVID-19, which we expect to happen to some extent. Future phases of the restart plan, we will work hard towards, and this will include more complex surgeries requiring a hospital stay, cardiorespiratory medical appointments, ambulatory care appointments, and additional endoscopic capacity. So this has been an unprecedented and challenging time, and I'm extremely proud of our teams, how we've responded to this challenging time with the pandemic. We've received enormous support from our community, and appreciate everyone's patience as we've worked through this. On behalf of everyone at the Georgetown Hospital, I want to thank you for your support. Importantly, thank you for doing your part, staying home, staying safe, and practicing physical distancing. This has made a difference. And now I will pass it back to Jeff, and hopefully we can answer some questions that have come up.
Thank you, Dr. Bussa. We'd be happy to take some of your questions if you've got some. As Sandra mentioned off the top, you can use the QA function on Zoom. If you're watching on Facebook Live, you can certainly leave us a question on Facebook, and we'd be happy to take your questions. Dr. Bussa, okay if we start with you? We have a couple of questions that came in before. Okay if we start with you?
Yeah, absolutely.
Great. So what can people expect when they come to the hospital?
Well, it's getting closer to normal, but it's still far from business as usual. We have a limited number of access points where you can enter the hospital, and at each of those points, you will be screened. So there will be COVID screening ongoing, and if unfortunately you fail any of those COVID screening measures, you will not be permitted to enter the hospital. We are really trying to restrict the number of people in the hospital and limit crowding. So there still are restrictions on visitors. However, as the restart plan continues, those will gradually be loosened as we are allowed to. And we're also, in the spirit of limiting crowding and maintaining physical distancing, we're tightly organizing appointments. So we're asking people to show up at a very specific time. And within the hospital, we're asking you to maintain your distance. So there will be some lining up. But otherwise, it's business as usual.
Thank you. One of the questions we've had quite a bit, and that came in before, was, do I need a COVID-19 test before I visit a family member in the hospital? And along with that, how do I get a COVID-19 test?
You currently don't need a COVID-19 result to visit someone in the hospital. However, you will go through the screening process that I just mentioned. If you do want a screening test, we do have a very busy clinic on site on the hospital property, and you can call the phone number. I'll give it to you. It's 905-203-7962, and they will pretty quickly get you in for that appointment. Just have your health card ready, and we're doing almost 100 tests a day here, so we have a very busy clinic that's working well.
Great. We get this question quite a bit. How long will it take to get caught up with all the surgeries and procedures that have been postponed over the last 4 months?
Yeah, it's a great question, and I can tell you that the physicians and staff at the hospital, we would like nothing more at this stage than to be working completely as we were pre-pandemic. We are concerned about the backlog of testing and procedures that has occurred. We just need to be cautious because it's important that we continue to meet the government requirements for ongoing monitoring and reporting of their essential indicators, or they could ask us to stop our restart plans or scale back. And we also must have a strategy to maintain flexibility to respond to a sudden increase in COVID in the community or in our vulnerable populations. So to answer the question, it's going to be months. We've not been doing some of these things for 4 months. It's going to take many months to catch up through this backlog. And to predict more precisely is impossible because we don't know what the future holds in terms of future COVID resurgence and how that's going to impact our ramping up again. But I will say that we really do appreciate everyone's patience. We are as frustrated as many of you have been. And also, I'd say if you have had a change in your status, if you're waiting for an appointment or a procedure or an operation and your condition has changed, you should let your physician or surgeon know, because that has certainly happened where things that were deemed elective suddenly become more serious over this wait, and your physician would want to know about that.
Great. Is there anything specific I should do to prepare for surgery?
Probably most importantly, I would recommend self-isolating for 2 weeks before your surgery, because if you have any symptoms at the time of your procedure, it would be canceled. So if you maintain good self-isolation at home, if you wear a mask, wash your hands carefully, maintain social distancing when you're and wear a mask when you're not able to, that'll put you in good stead for your procedure. Certainly, if you do develop any symptoms, call your physician or surgeon, let them know, and they will reschedule you where appropriate. And finally, on the day that you come for your procedure, if you have a support person, just show up with a mask, and we'll proceed.
Great, thank you. Dr. Bussa, do you mind repeating the COVID-19 testing phone number?
Absolutely.
Question come through.
905-203-7963.
Awesome. I think that's it for you, Justin. Thanks very much. Appreciate it.
Okay. Thank you, everyone.
We'll turn over to, we have a few questions for Cindy here as well.
Hi, I'm back.
Hey, Cindy, welcome back.
Thank you.
So one of the questions we get quite a bit is, how many COVID-19 patients are currently in the hospital? And you kind of touched upon this a little bit, but what measures has Halton Healthcare taken to plan for a potential influx of COVID-19 patients?
Well, today's a great day to ask me because today we have no COVID positive patients in the hospital. That wasn't true over the weekend, it changes from day to day, but as it happens, yesterday and today we've had no COVID positive patients. As part of the directive from the government and as part of our pandemic response plan, as I said earlier, our biggest goal in trying to prepare for this was to create capacity in the hospital. And I talked about reducing clinical activity, so we had more staff available. If you're not doing as much surgery, you don't have patients admitted postoperatively, so those beds become available. We did identify additional spaces where care could be provided. One of the things I didn't mention is we actually created a second intensive care unit here in Georgetown. So we have our one on the med-surg unit, but we created another one in the day surgery area so that we would have an ICU for positive patients and an ICU for negative patients. So that was another way that we created and prepared for this influx. But other examples I've got here, by reducing the number of operating rooms in use, we reduced the demand for inpatient beds. By grouping together those selected patients at one hospital that I talked about, obstetrics going to Milton. And finally, we looked at space in both Milton and Oakville that had not yet been developed. As part of their redevelopment plan, they had what we called shelled-in space that could be outfitted very quickly if needed, as opportunities for creating additional beds if needed. And we did do that, so they were ready had we needed them. So that's how we did that.
So you had a question that came through the chat, and it was regarding volunteers. And so when do we expect volunteers to return to the hospital, and what roles could you see them performing?
You know, I don't know the answer to that question. I think the volunteer response, the volunteers returning to the hospital will come as a part of a directive and part of a phasing in approach. We have not heard anything about when they come back. I think when they do come back, a lot of the previous roles that they've played in terms of wayfinding and escorting patients will still be in place. We've got active volunteers throughout the hospital, and I think that each of those roles will be assessed when the time comes and when the phasing allows us to do that. But to date, we haven't got any visibility on when that might happen, unfortunately.
You definitely miss them, eh, Cindy?
I do miss them. I do miss them. You know, they care for us as much as they care for the patients. And it's funny because we learned that in SARS. During SARS, I was working in a hospital in SARS, and that was the biggest theme we got out of that, was how much we missed our volunteers. And I think we are relearning that this time around.
So this question we get a lot too about PPE. So there's been lots of talk in the media and social media about PPE, personal protective equipment. We've heard about global shortages, community drives. Does Halton Healthcare have the supplies it needs to care for and protect our patients and staff?
It's funny that you ask, because it is one of the questions that I get asked a lot as well. So I'm going to give you, it's a complex answer. The short answer is yes. We have supplies. But having said that, we need to be very, very cognizant. And I think I said on the last time I was talking to this group about what we had learned through this. If we haven't learned anything, we've learned that we can create our own shortages. The toilet paper shortage taught us that. And I think we're being very, very careful that we don't create a PPE shortage. So we monitor our PPE supplies. And PPE for our purposes includes masks, respirators, eye protection, and gowns. So there's ongoing procurement via a number of different vendors, and there's channels for obtaining additional PPE if required through the provincial government. But we've already received support from the ministry to access additional PPE. But in addition to ongoing procurement, we've initiated processes to conserve our existing stocks of PPE, and that's probably been one of the most valuable things that we've done. I think it's also important for people to know that we monitor the inventory of our personal protective equipment on a daily basis, and we report it to our staff. We report it through our emergency command center. And I used this example before, but if I said to you that we had 1,000 masks, that probably isn't, or 10,000 masks, or 100,000 masks, that really doesn't tell you what our stock is. So we report it in terms of the number of days worth. So we actually monitor our use. And part of our restart plan for our ORs has been to look at how much PPE that will cause us to use. And then we predict how much, what our run rate will be, how much PPE, how many masks we'll use in a day, how many gowns we'll use in a day. And then when we report our supplies, we report on how many days worth of masks we had or weeks worth of masks we have, so that we can carefully adjust our activity to make sure that we are not running out of PPE. And we have not run out of PPE yet. We've had enough to deal with it. We also have what we call our traveling PPE cart. We have a cart that goes around the building with a staff person who mans that cart 24 hours a day. And when staff require PPE, they just call the PPE super user, and she comes to the unit and dispenses it. So we don't have PPE lying around for everybody to help themselves to. So we do really monitor it carefully. But to date, we've been fine.
Great. Thanks, Cindy. So I do have a question for Sandra, but before I turn it back over to Sandra, Cindy, are there any last thoughts you want to provide folks before we go back to Sandra?
Well, you know, we are a hospital, and our primary mandate is to provide acute care services, but we also have to work and collaborate and partner with other healthcare service providers. And we've learned that and done that, I think, well, and certainly more than I've ever done before in my career. And that's included our public health department, our ambulance or EMS services, our long-term care and retirement homes. And those partnerships and that collaboration is what we're doing to fight this disease. These are certainly uncertain and challenging times. And I think one of the things that we've all learned, and I know the community has had to learn this as well, is that things change and evolve, and what we're doing and experiencing today may be very different from what we are doing and experiencing tomorrow. So being able to live in that ambiguous kind of flexible environment is probably one of our life skills today that we're depending on. But I really want to reassure everyone that we are still a very vibrant and active acute care hospital that is here for you, and we are always here and ready to care for you. It's going to take us a while to get caught up. It's not a process that we can rush, and we are asking for your patience and understanding. But my final thought is, if you are sick and you need care, come to the hospital. It's what we're here for, and we've always been ready, willing, and able to serve you, and we'll continue to do that. So you would like me to change with Sandra now?
Yes, please, yeah. Thank you. Hey, Sandra.
Hey, Jeff.
We got a question that came in for you. I thought it might be good for you to answer. And it was about the bottle drive. And the question was, I've heard it's been really successful. Any idea how much has been raised for the foundation? Maybe you could talk a bit more about it.
So what Jeff's referring to is the beer store has been running a campaign where people, when they're returning their empties, they can basically donate the proceeds to the hospital. It's really easy to do. All you have to do is drop your empties off behind the beer store in Georgetown. Acton is also accepting your returns as well. This has been a phenomenal program, and we are so thankful to the beer store for what they've done. It really took off right from the beginning. I know, and we've been in contact with the beer store. At one point, Georgetown was actually #2 in the province for how much had been raised. I'm not sure where we stand now, but we know it's been an absolutely phenomenal response. So I don't have the most up-to-date numbers. The last I heard was around the end of June, and over $72,000 had been raised for the hospital. We do know that this campaign, they've extended it. They've extended it a couple times, I think. We know at least it's going until the end of July, and we've sort of got our fingers crossed that it's actually going to go right through the summer into Labor Day. So this has been truly phenomenal. We're extremely grateful for the community, for everybody who's been encouraging people to do this and participating, and it's been really a phenomenal response.
Yeah, sure has. Yeah. Great. So I think that's all of our questions. So I think I think we're probably at a spot where we can turn it back over to you to kind of wrap us up, Sandra.
Great, thanks, Jeff. I'd like to thank Cindy and Justin for coming on and giving such a great update about what's going on at the hospital. We sometimes, I think, take it for granted because we're here pretty much every day, so we kind of understand what's going on. But certainly, when I'm talking to donors, these are some of the questions that they come to me with, and some of our staff. They just kind of want to know what's going on, and you know, is it really bad, and are there lots of COVID patients and things like that? Do you have enough PPE? These are all the questions that we sort of get on a regular basis. So we wanted to be able to reach out and assure everybody that things are good here, and give an update, particularly as the restart plan is now underway and will continue, hopefully, if everything keeps going in the right direction. So I wanted to just give a couple of updates with the foundation and what's been going on. Clearly, our operations have changed as well, like everybody else in every business practically in the country. We are pleased, though, that two things have happened. One, we had a very successful spring appeal campaign. That was a match campaign. You may have received some direct mail on it or seen it in your email inbox. We had a match amount that was actually led by our physicians here at the hospital. So we're very grateful that they put forward their own money as an incentive to the community as a match program, and we were able to reach our goal on that. So we are very pleased and thankful for not only those that came together with the physicians to provide that match, but also the community that really responded and allowed us to reach our goal. And looking forward, we normally have a number of events that happen, and obviously in-person events aren't really possible at this point. But we are pleased that we are going forward with our walk or run for Georgetown Hospital. So please mark your calendars for Sunday, September 27th. We're keeping the same date. We're keeping basically the same time, although we will be doing it in a socially distanced manner. We will be encouraging people to pick a route around town and walk it or run it at the same time. And then we're going to have an online virtual finish line festival with some entertainment and some giveaways and surprises to wrap things up. So stay tuned for that. Please monitor our social media channels. We'll have lots more coming on this, but it's going to be a great way for us to really honor all the healthcare workers, the physicians, the nurses, all of the support staff here at the hospital. Is going to be our kind of theme this year to honor them through the walk or run for Georgetown Hospital. So instead of having one route down in the south end, we're going to have people walking sort of all throughout Georgetown and surrounding areas. And we will have an Acton route as well, at least one that we promote. So we hope that everybody can come out on Sunday, September 27th and walk or run and come together online at the end to have a fun celebration of everything that the hospital's done for this community. If you have any other further questions on anything we're doing, please don't hesitate to reach out to us at the foundation office. We do have somebody in the office, at least one person every day during the week, so you can give us a call or certainly connect with us online. GeorgetownHospitalFoundation.ca is our website. And of course, social media, we try and keep as up to date as possible and let everybody know what's going on through Facebook, Twitter, Instagram, and LinkedIn. So we mentioned, and I think all our guest speakers have mentioned, the support that we've received from the community. And we really wanted to show how much the staff and the physicians and the leaders here have appreciated that support. They really want that message to get out, that they've seen the messages and they appreciate all the little goodies they've been given and the PPE that's been donated over the last few months. So what we did is had a pretty fun time, and we ran around and took a little bit of video and some photos to really just to show some of the amazing support that has happened over the last 4 months, and from all of the staff, all of the physicians, all of the leadership at Georgetown Hospital to really say thank you to the community. So what we're going to do to wrap up this town hall is run a video. I know there's some people that are just on the phone, so they won't be able to see it, but it will be on our website later, and we will be putting the link out on our social media as well, so you can check it out there. So I want to thank everybody for their time today. I hope you have a great day, and I hope you enjoy this great thank you video, which is really A heartfelt thanks from everybody at Georgetown Hospital to the entire community for all the support over the last few months, but also going well beyond that. We have a fantastic community and we're very grateful. Thanks.